Let's bring in Perri Peltz, the director of that new HBO documentary. It's called Warning, This Drug May Kill You, putting a human face on the U.S. opioid addiction epidemic. It is an epidemic, and it's been underway, what, a year, 2 years?
It's actually, John, interestingly, it's been underway for several years now, but only really became part of the public psyche, I think, just in the last year or so. But now we're up to 91 deaths a day, and they believe, the latest data out of the CDC is that that number actually may be an underestimate because coroners, there's some misclassification of deaths at overdose.
And these generally are people who might get a prescription, they break a leg or something, they need, some kind of a painkiller, and then they just get hooked?
So that's a great question. And when we started doing this, the narrative around this epidemic was, well, it's kids, they're abusing good drugs that they're finding in their parents' or their grandparents' medicine chest. And what we found is that's not really what's going on. This is really not an epidemic of abuse. This is an epidemic of addiction. And in the vast majority of cases, people's initial exposure, at the very least, is coming from a prescription that they're getting from their doctor. And, I want to make it clear that these medications, opioid medications, are good under the right circumstances. You have severe pain, you've had surgery, end-of-life pain, cancer pain. These are appropriate medications in that setting, but for short periods of time. The problem is when you have a long-term chronic condition that you're taking these medications for long-term, it's a recipe for disaster.
Some states are seeing the problem in far greater number than others. West Virginia, I understand, the death rate is 43 people per 100,000?
West Virginia has been particularly hard hit. All of New England has been very hard hit. Ohio.
Why those places?
That's a great question. It's a complicated question, but it tends to be where there has been a lot of overprescription, overprescribing of opioid medications that this tends to follow. So why are doctors in some states prescribing more than others? That's a complicated question.
You hear opioid addiction and you think heroin. But it's not necessarily just heroin.
No, that's absolutely right. But to your point, and it's a really good point, heroin is an opioid. So fentanyl, OxyContin, Percocet, Vicodin, I could go through a whole list. They are chemically related to heroin. They're very similar, and the effects that they produce are indistinguishable. So if you're somebody and you've been given OxyContin, let's say you've had surgery, and you've been given OxyContin, and then you run out and you can't get another prescription, which may be a very good thing. If you are addicted or you're dependent, then there's a possibility that you will go to the illegal form of the opioid, which is heroin, which we know is easily available and very inexpensive.
The documentary is called Warning, This Drug May Kill You. You can catch it on HBO.
You sure can.
Perri Peltz, the director.
Thank you very much for having me.
Thanks for coming in.